Okay, good afternoon, everyone. Thank you for joining today's webinar. Before we begin, I just want to cover a couple of technical issues. First, if you come across any problems, please chat to the host. You can find the chat box on the right side of your screen, and if it does not appear, click the dialog bubble on the top right toolbar, and it'll pop up. And at that point, you'll be able to chat any problems that you have to the host. During the webinar, you'll be able to chat your comments and questions to the panelists. And what we're going to do is compile those questions and hold them until the end of the presentation. And then I just want to say we will leave plenty of time at the end also for chat, so you'll have opportunities to ask questions about participating in the learning community at the very end. So with that said, we're going to get started. We realize there are many more people who are registered for this, but we're going to get started. And so on behalf of the Community Technical Assistance Center of New York, it is my pleasure to welcome you to today's informational webinar for the Resilience-Informed Service Environments Learning Community. This is an incredibly exciting project for us. Launching it today is something that we've been looking forward to do for quite some time. I want to turn things over to my colleague, Dr. Anthony Salerno, who brings a great deal of experience with learning communities like this to the CTAC, and I just want him to say a few words before we get started.
Great, thanks a lot, Jim. Yeah, this is Tony Salerno. I just want to really, as Jim said, just to welcome you to this. You know, I've spent many years working with organizations around the country with respect to trauma-informed care, and the area of resilience, I think, was one of those that is really going to fill in the gap and bring together what we've learned about trauma and what we understand about the protective factors and strengthening individuals' capacities to deal with life stresses. And I've worked with the Office of Mental Health for over 30 years, running inpatient, outpatient type of programs. And there's a great deal that I've learned along the way, and especially the lessons learned from organizations around the country who were implementing principles and practices of trauma-informed care. And the area of resilience, I think, is going to add a very special component. So welcome, everyone. The whole team is here to support you. Want to congratulate you on your efforts to improve services. And the people you serve would also appreciate very much what you're doing, because all of this is in an effort to improve the life experience of the people you serve. So I'm looking forward to this in the months ahead, and we'll bring all of our resources and experience to support you in your efforts. So thanks very much.
Thank you, Tony. And, you know, for us at the CTAC, we're lucky to have Dr. Salerno and all of his experience involved in this project. I'm just going to turn it over right now to some quick introductions. I'll start with myself. My name is Jim Rodriguez, and I work here at the CTAC. I'm a senior research scientist. Don't let that scare you. What that means is I come here with a lot of experience in training and research, but also direct clinical practice. I am a licensed clinical social worker in New York State, as well as a licensed psychologist, and I have a great deal of practice experience, and I'm also in private practice, and I have a great deal of experience in the area of trauma with children, adolescents, and adults, and a great deal of interest in general in trauma-informed care, so I'm really looking forward to this learning community and getting folks involved in this movement. Kara?
Yes, hi everyone. Thank you, Jim. Welcome to our webinar. We're really excited to have you all join our efforts because we've been working on this for a very long time. And so my name is Kara Dina Sale, and I am a social worker and have been for over 20 years. I work with CTAC and the McSilver Institute for Poverty Policy and Research, where I help to co-direct a department in the Institute called the Clinical Education and Innovation Department. So we provide trainings and opportunities to work on different best practices and clinical opportunities that we bring to CTAC. So really excited to be here. I'll pass it on to my colleague, Jason Jones.
Good afternoon, everyone. This is Jason Jones. I'm also part of the McSilver and CTAC team. I'm a licensed social worker, and I'm really happy to join everyone here today. I manage our learning management system, which you will hear more about later.
Great, thank you. Good afternoon. This is Diana. I'm a social worker and research scientist at McSilver's Clinical Education Department, working on trainings and research projects. I primarily worked with adults in inpatient settings as well as outpatient case management organizations. And again, on behalf of all of us on the panel here today, welcome to today's informational webinar.
Great. So that's a little bit of the team, and actually there will be other resources of the CTAC available to this project. A few words about the CTAC. One is the Community Technical Assistance Center. Many of you probably have been on other webinars and involved in our projects, but our mission is to provide, obviously, training and technical assistance to many sort of primarily behavioral health organizations and agencies throughout New York State, but we also have participation from service providers in a variety of sectors, from social services to education and so on and so forth. And our job is to really provide information that people can use to improve practices and provide better services in a variety of settings. Our funders are OMH, the New York State Office of Mental Health, the Office of Alcohol and Substance Abuse Services, and DOH. The reason why I say that is because one of the reasons why we can afford to do this learning community with no cost to you is because of the support that we get from the state. So our agenda today is, first, to talk a little bit about trauma-informed care. We've done a lot of trainings and webinars on trauma-informed care. People on the call may already know a little bit, but we just want to say a few things for those who may be new to the topic. We're going to talk about the importance of resilience. We recently did a webinar on resilience, but as Dr. Salerno said at the beginning, we believe that moving into resilience building is the next stage in the evolution of trauma-informed care that we want to sort of be a part of. We're going to talk about the learning community and give you details about what participation in the learning community will mean and what it will involve, and why the learning community is important. And then we are going to say a little bit about the evaluation that we're going to do. It's a minor evaluation that we're attaching to this for those who are going to be participating in the learning community. This is also, I want to sort of point out, this is a pilot learning community. So we hope that this will lead to additional learning communities and grow. But we're piloting this, so we also want to do a small-scale evaluation for those who participate, and then go over again the nuts and bolts and the activities that you'll be involved in and the time frame, and then, of course, save time at the end to answer any questions you may have about participating.
Great. Thanks, Jim. So we want to start by hearing who is on the webinar with us. So this is a poll question. If you can just answer A, B, C, D, E, F, or G, a lot of options here, and just let us know what kind of services you provide. So we really want to get a sense of who's with us today and the services that you provide. Are they mental health services for families or adults, substance abuse services, school-based services, inpatient services, residential services, or peer services? So if you could just check one of those, and then we'll see who's on the line with us. Okay, so we're waiting for our results. I wish we had our little music here. And I just want to say, if you have any questions along the way, to please chat them in the chat box, which is on your right-hand side, so that we can gather questions for the end of our time together. And it looks like most people are providing mental health services for families or adults. So thank you so much for being here and participating in our poll. It's helpful for us to know what kind of services you provide and where you can come from. Okay, so we want to start our discussion really talking about trauma-informed care. And I want to say that, you know, I think I mentioned in my introduction that I'm a social worker and have been for a number of years. But I want to also let you know that I've never been so excited to be part of this field as a social worker. I think, you know, there's a real movement around trauma-informed care happening. And if you weren't a part of it before, then you absolutely are now by being on this webinar and considering to participate in our learning community. So for years, you know, I had a sense of frustration in my work, feeling like I don't know if I'm really helping people or really understanding, because some of our work really focuses on what's wrong with people. And so when this work around trauma-informed care started, for me it was an opportunity to reframe and think about, oh my gosh, finally we're thinking about what happened to people, not what's wrong with everyone. And so we do have a resource at the end, a TED Talk by Dr. Nadine Burke-Harris, who really has an excellent way of talking about the importance of this work. And so I recommend that you listen to that if you haven't. But I think what the biggest takeaway for me is that she says that, you know, as she's a doctor, pediatrician, and she also has a degree in public health. And she said, you know, when in public health, we learn that if kids are drinking from a well and they're getting sick, that if that happens time and time again, then we know that we write a prescription for the sickness. But what this movement is urging us to do is to go to the well and think about that water and not just hand out those diagnoses and not just hand out those prescriptions, but really thinking about what we can do differently. So trauma-informed care really refers to how we think about and respond to those who have experienced or may be at risk for experiencing trauma. So it's really important because of the pervasiveness of trauma, and trauma-informed care helps us shift, again, our perspective from what's wrong with you to what has happened to you. Hopper and others have said that trauma-informed care is a strengths-based framework that is grounded in the understanding of and responsiveness to the impact of trauma that emphasizes the physical, psychological, and emotional safety for both survivors and providers, and creates opportunities for survivors to rebuild a sense of control and empowerment. And that's really where this concept of resilience comes in, around thinking about control and empowerment. There's some studies that have demonstrated the serious health and mental health consequences of trauma, so the adverse childhood experiences and other ACEs-related research that we're not going to go into detail, but we could make that available to you if you're interested. And then I think most importantly is that trauma-informed care is relevant in every service delivery system, from social services to juvenile justice to schools and early childhood and health, and of course health and behavioral health and substance abuse services. So I want to talk just a little bit about the ACE study. As I mentioned, the ACE study, if you haven't heard of it, is the Adverse Childhood Experiences Study, and I'll just review it really quickly. It was a collaboration between the Kaiser Permanente, an insurance company, and the CDC, and it really began with Dr. Vince Folletti and Dr. Bob Anda, and it's the largest study done on the subject with over 17,000 people participating in California. And it looked at the effect of adverse childhood experiences or trauma over the lifespan. So there were 10 types of childhood traumas measured in the ACE questionnaire. 5 of them were personal, and then 5 of them were related to the family system. And it turns out if we experience any of these adversities, that we are more likely to have health problems, including asthma, diabetes, heart disease. We're more likely to participate in health high-risk behaviors, including smoking or early sexual behavior. We're more likely to have depression or suicide, or use substances, or have social problems, such as living in poverty or experiencing domestic violence. We're even more likely to have poor academic achievement, or even early death. And then, and I think we all know how prevalent this is. And I think one of the most important things I learned is that 64% of people experience at least one ACE out of that study, and 20% reported 3 or more. And then it was found that adults with an ACE score of 4 or more were actually 460% more likely to suffer with depression. So not only is trauma and adversity in early childhood prevalent, the impact is pervasive. And so all of this helps us to think about what we can do about it.
Thank you, Kara. And so the ACEs study just underscores that the likelihood that you all on this call, providers, people who work in the mental health field or the substance abuse field, in PROS programs, in mental health programs, inpatient, outpatient, in social service programs, and all the variety of programs that you work in, the likelihood is great that those folks who you're working with have some kind of trauma history or exposure to adverse childhood events. So that study has spurred a lot of work among folks who are interested in providing good good services to think about trauma-informed care. In many ways, ACEs was the beginning of trauma-informed care. And so in addition to that, a number of agencies, federal agencies, have also become interested. The one who's been leading the charge on trauma-informed care is SAMHSA, the Substance Abuse and Mental Health Services Administration, and they've been accumulating evidence and providing supports and technical assistance and information to help organizations become more trauma-informed. I'm not going to go into detail, but this is something that they put together to help people understand why trauma-informed care is important. So in their sort of thinking, a trauma-informed organization is able to do these four things. It realizes the prevalence of trauma, understands ACEs and understands the impact of ACEs. It recognizes the impact of trauma on patients and staff. One of the things that we always talk about that's critical to understand in the trauma-informed work is that we're not only concerned with how trauma affects the people we work with, but also how it affects the people who work with the people we work with, the caregivers, the service providers. The other thing that trauma-informed organizations do is respond and putting knowledge into practice. That's the whole reason why we're doing this learning community. We want to give you the knowledge and understanding of ACEs. We want to give you an understanding of how trauma impacts people. We want to also give you information, and this is what we're hopefully leading in, is what role resilience plays in this. So how to put all of that into practice and change policies and practice and procedures at your organizations to make them more trauma-informed. And then the bottom line is because of the prevalence and impact of trauma, trauma-informed organizations need to understand and resist re-traumatizing people. And then one other R that we want to add is, as we've talked about already, is remembering resilience, that the impact and the importance of understanding resilience is critical to trauma-informed care. So SAMHSA not only sort of put those things out around trauma-informed organizations, but they put together some principles around trauma-informed care. So, you know, you're not going to be able to find a manual or a book out there on how to do trauma-informed care. But what we do have is things like these principles, and we believe these principles are critically important. They provide direction for helping organizations understand what's critically important and what trauma-informed care looks like. And so as part of your participation in the learning community, we're going to talk a lot more about these principles, but more importantly, what this means for practice and policy at your agencies. I'm not going to go into depth on these, but principle number one, safety, speaks to a critical need for people who've been exposed to trauma and adverse events. You need to create a safe environment. We'll talk about ways in which you can do that, both at the individual service provider level, but also at the organizational level. Principles 2, 3, and 4, trustworthiness and transparency, peer support and mutual self-help, collaboration and mutuality. Those really speak to the importance of relationships and what an impact relationships have in people recovering from trauma and being able to cope with trauma and adverse events. Again, we'll talk about ways in which you can do this in your work. Empowerment. Principle number 5 really talks about the critical importance of helping people. Kara mentioned it earlier. One of the greatest impacts that trauma has on people and adverse childhood events have on people is a feeling of a lack of control in your life. So when we talk about the principle of empowerment, voice, and choice, it's being able to help people gain or regain control in their lives. And then lastly, and this one is really important, cultural, historical, and gender issues. And I'm really impressed by the fact that SAMHSA, an agency of the federal government, has outlined and listed the importance of cultural, historical, and gender issues. What we're talking about there is the importance of understanding not only culture and the impact that it has, which we often talk about, culturally sensitive practice and culturally competent care, but also the understanding of the impact of racism and discrimination, and what impact that has on trauma, and also what impact issues of gender has on people's trauma, and in addition to that, the importance of historical trauma. In many ways, this last principle speaks to developing anti-oppressive practices in agencies and organizations that also are critically important. So we see trauma-informed care and anti-oppressive practice in many ways as being very closely related to each other, and that last principle addresses that. And as I said, in the learning community, we will provide information and clearly outline what we mean by all of these things and what it means for policy and practice. So the bottom line is with trauma-informed care, again, the idea that it increases safety for all in a trauma-informed organization. It improves the social environment. We provide care for the caregivers. We help organizations think about how they're taking care of the people who are taking care of people receiving services. We believe it leads to an increase in the quality of services. It reduces, if you have a trauma-informed approach, reduces negative encounters and events, again, resisting that re-traumatization, and creating a community of hope and health, people moving into wellness and recovery. And then lastly, increases success and satisfaction at work, again, both for staff as well as the people receiving services. So why focus on resilience? So very simply, again, we recently did a whole webinar on this. So I'm just going to try to summarize it. But very quickly, what's very clear is that trauma is an internal event. Adverse childhood experiences and trauma is an internal event that causes human suffering, right? That's obvious. And one of the reasons why it's critically important to talk about trauma is because at least it is a knowable reason why people suffer in the here and now, okay? So if you believe that is the case, and there's no reason to not, right, we believe that a thorough understanding of resilience is the road to prevention or recovery from traumatic events and adversity, okay? And very quickly, the reason why we believe that is because, first, this thorough understanding has to focus on something that oftentimes is a misconception. We believe that resilience is not an individual trait. It is not something that resides in the individual. So our working definition of resilience, one that's out there in the field, we're not sort of changing the definition. There's quite a bit of research that looks at resilience as a dynamic process reflecting positive adjustment despite significant risk or adversity. In many ways, we see resilience as the opposite side of trauma. In other words, if we know external events have an impact on human suffering, then external events, not the individual, can help people overcome and recover from adversity and trauma. It is a process. So basically, in order to understand resilience, we see it as if you have a person who's been exposed to traumatic or adverse life events, and they have been able to show that they are able to recover or overcome those adversities and that traumatic exposure, the outcome is resilience. They have demonstrated resilience, as opposed to it being an individual trait that someone has and needs to overcome adversity. We can talk a lot more about that, but that's the basic idea. Again, if external factors impact and lead to human suffering, external factors can help overcome and help people recover from those. That is where resilience lies. And to put it another way, when we think about it, we're not saying that there aren't individual aspects that can help a person overcome or recover, but that's only part of the picture. People do have individual strengths. They have problem-solving abilities, they have intelligence, they have their ability to control their emotions or other internal strengths that can help them overcome adversity. But we also believe that there is a critical importance of significant others. The simplest example of this is parents, right? We know that young children who have parents who monitor and help and use appropriate discipline strategies and support their children are more able to overcome adversity than those who do not. So the importance of significant others. But the importance of significant others includes others, such as peers, later on in adolescence, during adolescence. Adolescents need more peers, but also adults. When we talk about the peer movement in recovery services, people like sponsors who for folks who are getting substance abuse care, people who connect with others who are incredibly important in their lives can make an impact and help people achieve resilience. And then mentors and other folks. There's a lot of folks who sort of come under that. And then lastly, and again, one of the reasons why we do this learning community is understanding the importance of systems and culture, that strong service-providing systems can help. Schools, mental health programs, PROS programs, all the kinds of programs that you work in, those systems can also help to promote resilience and help people overcome and cope with their adversity and trauma. And then the other thing is culture, right? So there's also a critically important piece in understanding the importance of things like religion or connection to one's racial, ethnic, and cultural groups in general. That can help people overcome and deal with and recover from trauma and adverse events. So we believe that resilience falls at the intersection of all these things and doesn't just fall at the individual level.
And I think to summarize, the biggest takeaway is that relationships really matter. And of course, all of you know that. As Jim had mentioned, relationships help with not only coping with adverse events, but also healing from trauma experiences. And so we really like this quote because it really helps to summarize that we are more likely to make a meaningful connection if we understand the ever-present role trauma plays in undermining the foundation of trust and shattering relationships in the lives of people with whom we work. Because trauma very often happens in the context of relationships, it is within relationships that healing must necessarily commence. So building resilience also happens in relationships. And that's why we want to make sure, I really appreciate the way you break that down, Jim, in regards to resilience, internal factors, but most importantly, those relationships with culture and systems and also our significant others. So I want to chat with everyone. I want to hear from you because I'm sure you're all doing things right now around really building resilience in your work and with people that you work with. So would you share some of that? In what ways is your organization currently engaged in resilience building practices or policies? So if you could just chat into the box with us, we'd love to hear from you. In what ways is your organization currently engaged in resilience building practices or policies? And if you don't think you are, then you could also chat that in, but I'm certain that most of you are in some way, and we'd love to hear about that. Oh, great. So we have a comment from Cheryl who says, looking at reflective supervision. Fantastic. So reflective supervision is a fantastic resilience building practice. Promoting person-centered care, Jean comments, employing and promoting peer services, fantastic. Seeking safety, that's a really great intervention that's used with teens and adults around substance abuse. I'm not sure. I'm somewhat sure our DD unit uses some resiliency skills. Fantastic, Marilyn. Thank you for chatting in. Peer services. And so it sounds like a lot of people are using peer services, which helps to build resilience in practices and policies. Thank you, Larry. Trauma-informed supervision in group and individual forms, and then seeking safety. Fantastic. Thank you. Weekly groups focused on building resilience in our outpatient program. So you're already participating in a lot of efforts to build resilience, not only in your practices, but also which also leads to policies often. Leadership trainings on trauma-informed care and person-centered planning. And my agency, Sarah reports, my agency has been working to inform staff and use the correct verbiage, not what's wrong with you, but instead what happened to you, also peer services. both in the clinic and also in community-based work. Thank you all so much. This is really helpful for us to get a sense of what you're doing, because we know that you're already doing so much. Pro services, I just wanted to mention, Tori chatted in. And it looks like Carmen is looking at current policies and contracts to make changes. And then finally, Jean says recovery versus a maintenance model.
Great.
Fantastic. Thank you so much for chatting in.
So those are great. And one of the things that we do want to point out, and one of the advantages of a learning community is, and again, as I said, we're not sort of presenting a manual or a specific set of, we certainly do want to talk about strategies and approaches and things that work. But one of the things that's important in a learning community is that we also share from each other. So many of the practices, and this is what I want to point out, is that one of the things that we might do in this learning community is also showing and underscoring what you currently do already that is resilience building, but then identifying those areas where you can improve or increase your ability to provide resilience building services. So there is, and that's the advantage of a learning community, that we can learn from each other. There may be things that you're doing, but the main question that you need to answer about participating in this learning community is, can we do more? Can we do more? So we're hoping that if you join this learning community, you can share what you're already doing and learn from each other as well, and learn what others are doing that can be resilience building. So I also want to turn it over to Kara again to talk about a learning community, because Kara also has quite a bit of experience with learning communities in general.
Thanks, Jim. Yep. Here in CTAC, we have offered a few different kinds of learning communities, but it's been a while, so we're really excited to offer this again as a methodology for learning and improving services and practices and policies. So, you know, a learning community is really an opportunity for people or programs or organizations really to get together to improve services related to a specific area of quality, and in this case, we're looking at trauma and resilience-informed care. So it's an opportunity for people or programs or organizations to learn from each other. That's a huge piece of the learning community, by sharing their experiences with each other and hearing from each other. It's also a method for learning that's guided by a resource team to support all members or participants in the learning community. And so, as Tony mentioned, we are part of the resource team, but there are others, and so we are a valuable resource for you and here for you in any way that we can support your work. And the reason that learning communities are important is because they they become an opportunity for not only networking and sharing those learned experiences, but also, you know, so many of you, as you mentioned in these chat boxes, you're already doing such amazing work and have so many lessons you've learned or ways that you want to improve your work. And so it's an opportunity to really reflect on that and figure out ways to take your work to the next level. So it really builds on the collective knowledge and wisdom of your real world experiences, which we call practice wisdom. And I always love opportunities to share practice wisdom. The learning communities become really an efficient, so they're a fast and effective way to support this widespread practice improvement and knowledge around, for us, around trauma-informed care and resilience-informed care. And then it really ensures that common and unique concerns, challenges, and needs are addressed again. That's where our resource team comes in. And so these are, I just want to go over the aims of our RISE learning community. And again, RISE stands for Resilience-Informed Service Environments. So this, you know, when I say efficient, I mean it. So we're a 4-month partnership with organizations across New York State. Anyone and everyone is invited to participate, and there's no cost. This is, again, through our CTAC work. Thank you to the Office of Mental Health. And we're looking for people who are really interested in exploring trauma and resilience-informed care. And so we're aiming to build that common understanding of trauma-informed care with practitioners and supervisors and administrators. And the way that we do that is through, we're going to do some online training. And so this means we'll be providing training and support to implement resilience-informed strategies in your organizations. and we hope to assist and we aim to assist organizations in conducting an organizational self-assessment of practices and policies consistent with trauma and resilience-informed care. And then our aim is really to assist your organization in the process of organizational change management, including taking actionable steps by identifying an improvement goal and plan. And so this is what we hope to do, our aims of our 4-month partnership with you.
Great. So what you get out of participating, and again, I want to reinforce, and I think some of the folks who were sort of chatting in some of the things that you already do, again, I just want to repeat, we're not pushing any particular approaches. So the person who talked about seeking safety, or a couple of folks who talked about seeking safety, nobody mentioned it, but there's also like the sanctuary model. There's a lot of different models out there for doing work that is really trauma-informed and very clearly able to help organizations and service providers become more trauma-informed. There's been a number of individual and group interventions that have been developed to help people from childhood through adulthood deal with trauma. So one of the things that this learning collaborative can do is help people identify those, see what's out there already that can help, but then also how to implement it, how to get it into your organization, and how to get people to use it. And then I would also say, though, for those of you who already are using programs like Seeking Safety and have already gotten trained, then the question would be, what is still left? I've worked in many organizations and I've been trained in a lot of different approaches. There's never any one silver bullet. There's always a variety of approaches that can work, and I think we've all been to trainings where you get trained and then nothing happens. So what we hope is that this process will help you identify things that you can actually implement that have legs and can be sustained over a long period of time. What you get out of the learning community, hopefully, is that so you will be getting educational, web-based training, very specific training on trauma-informed care foundations, organizational self-assessment, and change management. You're going to get information, knowledge, and hopefully the ability to raise your awareness, but also the awareness of your staff and workers in your agencies. Then there's going to be consultation calls. We're going to have consultation calls over a couple of months period that can help you identify those areas of change. And then, so what we hope is you'll have a deeper understanding of trauma and resilience-informed care. But more importantly, for those of you who already have some good knowledge, maybe some ways of using that knowledge to disseminate it on a larger scale within your agency or organization. A deeper understanding of organizational change management. To be honest with you, some of you may want to just join just to learn how you engage in an organizational change project within your agency. And then you will be guided through a thorough organizational self-assessment of your practices with feedback regarding trauma-informed care, resilience-building, resilience-informed care. And then, as Kara mentioned, access to the resource team via email, phone, and online office hours. So we'll have plenty of supports for you to have conversations and ongoing dialogue about how to implement your plans. And then, so a little bit more specifics about the expectations for the activity. So the first thing is participating. If you decide to participate, you're going to involve your core implementation team to serve as champions of this work. I'm going to say a little bit about the core implementation team in a second, but simply you're going to identify a core implementation team, and that core implementation team will be expected to attend 2 90-minute webinars. As we talk, and we'll talk a little bit more about those specifically later. 2 one-hour consultation calls with the CTAC consultants. 1 one-hour final interactive webinar. And then we're also going to, of course, ask you to complete an organizational self-assessment. It takes less than 50 minutes to complete, but an organizational self-assessment of your trauma-informed care practices. And then participate in a brief pre- and post assessment of your participation in the learning community. Very brief. It should take less than 10 minutes, about 10 minutes or less, to complete this assessment. As I said, to go back, quick word about the core implementation team. It is a work group within each site that's focused on trauma and resilience. It is stakeholders within the site. So that could mean practitioners, leaders, supervisors, clients and program participants, and peers. You decide to identify the members of the team from each agency, but the team is going to be focused on trauma-informed care and resilience-informed service environments. You can involve anybody you want who's interested or committed to trauma-informed care and resilience building, but it should include, we really push for at least a minimum of 3 individuals, and that's really not sufficient, but if you're stuck, at least a minimum of 3 individuals. So it should be a coordinator for your learning community at your agency plus at least 2 more people. We also recommend that there be at least 1 supervisor or administrator involved. Now, that could be the coordinator of the learning community, but also if it's not, there should be a supervisor or someone from the administrative staff who's informed and understands what the project is and is able to provide oversight and some support for the project. And even though these are the minimum level of expectations for participation, it will involve meetings and activities outside of those that are being offered here. In order to make this work, there does have to be a commitment to doing this work in between those webinars and conference calls. So there is going to be some extra stuff that you're going to need to be involved in to really make this work. So it is going to take commitment on the part of the the core implementation team to move this work forward within your agency. Diana?
Great, thanks, Jim. So this learning community includes 2 webinars that will focus on building awareness, knowledge, and competency. We'll start off with the basic concepts of trauma-informed care in order to build a foundational understanding. Because the individuals doing this work also matter, we'll cover vicarious trauma and secondary traumatic stress. Jim did mention this earlier in regards to caring for the caregivers. We'll also highlight the importance of resilience in service organizations and provide strategies so organizations can expand from becoming a trauma-informed care service environment to really a resilience-informed service environment as well. We hope that the initial training on awareness building and these basic concepts of trauma, secondary, and vicarious trauma and resilience will be a resource you can use to conduct more in-person training within your organizations. And lastly, we'll review organizational change management and organizational self-assessment, which again, as Jim mentioned earlier, will be filled out by each participant of the learning community.
And before I move on, again, I just want to underscore what Diana said. What we want is that core implementation team to be the experts of trauma-informed care within the agency. And so that first training may be stuff you already know, but we're going to give it to you in a way that you're going to be able to use to raise awareness and knowledge within your organization with others.
Another component of the learning community are the consultation calls, as mentioned earlier, and these will provide a chance to really develop and implement your organizational change. So during these calls, we'll focus on identifying key targets for change, developing a plan to implement the change, as well as offering feedback and monitoring your progress. And although not technically a consultation call, our last activity together as a learning community will be an interactive webinar. We'll cover sustainability because we hope that you will be able to continue with your efforts to incorporate both trauma and resilience-informed care. This learning community and the creation of your CIT, your core implementation team, is a great start, but we want to provide you with some skills to keep this moving forward after the learning community has ended. So this webinar will also be an interactive experience in the sense that sites will have the opportunity to share the work that they've done together and really learn from each other.
Okay. And so the organizational self-assessment, I'm going to say this briefly. We have partnered with Coordinated Care Services, Inc. It's an organization in New York State that developed an organizational self-assessment tool. It has an online platform, and it covers domains of organizational trauma-informed care and you could see some of the domains there. We're going to be focusing for the purposes of our learning community on those first 5 bullets: screening, assessment, and treatment, training and workforce development, engagement and involvement, physical environment, and collaboration. But there are others like evaluation of trauma-informed work within the organization, government and leadership, and progress monitoring, finance, and policy. These are all some, but one of the things that we want to focus on is giving you all a tool that can help you identify the areas within your organization that do need change in order to become truly trauma-informed. And these, I want to say that this organizational self-assessment that CCSI was developed, going back to what we mentioned earlier, the SAMHSA, the Substance Abuse and Mental Health Services Administration, based on their guidance around trauma-informed organizations. It's a really helpful tool. What you will get when you complete that organizational self-assessment is a very clear sort of dashboard of how people within your organization see trauma-informed care within it, and then actually some very specific guidelines and feedback that you can use to fill those gaps where you're low in specific areas.
Great, thanks, Tim. So for the virtual learning community, we'll actually be utilizing our learning management system known as the CTAC Self-Learning Center. And within this capacity, you could think of it as your one-stop shop for everything that has to do with RISE. And it's essentially an online platform that will allow us to give you access to everything that's involved within the learning community, including all of the webinars, consultation calls, as well as resources that we think will be important for your organizations. And most importantly, it will give us the opportunity to have you share resources with each other to really learn from other organizations and better your own practices. And how that will work is that every member of the core implementation team will be given access to the learning management system. You'll be able to create your own profile, and you'll actually be able to return to this site at any point to gain access to all of the resources. So the webinars, consultation calls, they'll all be recorded. And we really emphasize that we want everyone to really utilize this service.
And then, so a little bit about our quality improvement method. Basically, just a quick overview, as we've already covered. You're going to identify a core implementation team. We're going to provide you with education, knowledge, awareness building for you, as well as that you can use for within your organization, the self-assessment that we just talked about. And then you're going to identify some improvement goals, some areas that you want to work on. It's a short, brief learning community, so what we're going to focus on is meaningful but doable change that you can engage in just to get things started. And then we're going to help you create an improvement plan or an action plan. And then we're going to guide you through our plan, do, study, act process. This is kind of not ours, we didn't invent this, but it's just a way of thinking about how you're going to actually implement your plans. As I said, this quality improvement process for some organizations is in itself useful to learn when you're trying to think about how to make change within your organization. And then, as I said, we're going to have a brief evaluation tied into this. So very, very briefly, for those who are participating in the CIT, we're going to ask you to complete brief measures of trauma-informed care knowledge. So again, we want you to be the experts. We're going to test your knowledge of trauma-informed care. And then we're also going to ask you some questions about your attitudes regarding trauma-informed care. These brief measures are going to take less than 10 minutes each. And then, as we already talked about, you will also all complete the organizational self-assessment as part of the evaluation, in addition to helping you identify areas for change. The other thing I want to say about the organizational self-assessment, we are requiring it for those who are on the core implementation team. But once we start that process, you can disseminate that organizational self-assessment to as many people as you want within your organization. We're just saying we're requiring it of at least of the CIT members. And then we're going to get sort of information about the satisfaction and the usefulness of all this. And then also we're going to try to engage certain sites who are interested in focus groups to give us a little bit more deeper and qualitative information about your experiences in this project and what changes it's leading to.
So when thinking about the schedule for the actual learning community, we're going to go through a few phases. First is that all applications are due on March 1st, and we really want everyone to identify who the members of their CIT are and think through how they want to participate within this project. Next, on March 15th, will be the first webinar, which will be an hour and a half, really just going over some of the core components of trauma-informed care, resilience, and vicarious trauma. On March 29th, we'll actually go over trauma-informed organizations, and this will be an opportunity for all of you to really get your hands on the organizational self-assessment and start thinking of how you can implement some of these things within your organization. Next slide.
Oh, sorry, Jason.
No problem. So in April, we'll actually start our group consultation calls, and these will focus on action planning. So really thinking through next steps. What are some plans that we could put together as an organization to attack some of these domains? In May, we'll start individual consultation calls, which will focus on implementation. So now that you have your plan, how do you see through with them? And finally, in June, we'll have our interactive webinar, which will, one, focus on sustainability, so how do we continue our efforts, but it'll also be an opportunity for each of your organizations to do presentations on what have you done so far, what's worked well, and what are some of the lessons learned.
Okay. And then we just want to say a little bit about your resource team. These are an incredible group of folks who are working here at the CTAC. And I will say they all have different roles within this, but they all have experience in training on trauma-informed care, on things like anti-oppressive practice. Dr. Salerno, as we mentioned earlier, has been doing this work on learning communities and trauma-informed care for many years in a variety of settings. My colleague, Kara, is a walking encyclopedia of trauma-informed care, not only in New York State, but across the country. Brianna has done work on anti-oppressive practice. Jason has done work on anti-oppressive practice, and he and I put together a webinar about a year ago on historical trauma. Diana is our resident expert on vicarious trauma and secondary trauma. So we have all the folks on this team not only have various roles, but a lot of expertise that they bring in into subject areas. We also have, who's not on the call, Aya Port, who is an instructional designer who's going to help us with our materials that you can use in your organizations to disseminate this information. And we have a wonderful intern, Tara Reddy. So it's a great team, and I also want to point out that the CTAC has many other resources. Within the CTAC, we have experts on everything from clinical practice to management systems and finance. So if there's a need that you have, we'll be able to fill it and get you some resources and information that you can help to implement your plans. Diana?
Yes, thank you so much for that, Jim. So how do you join us? You have on your screen here listed 4 ways that you can join us. We have an application that you will need to complete and submit to us by end of day on Thursday, March the 1st. First way, an easy way right now, the application link has actually been posted to your chat box, so you can certainly click on it and postmark for later. You can also go to the RISE webpage on the CTAC website, and you do see the address link here. You will also be receiving an email from CTAC once this webinar is over with the link to the application. And lastly, you can certainly email us at ctac.info@nyu.edu for the application link. And again, we do look forward to your participation with us.
And very quickly, these slides will be available within the next 24 to 48 hours. So if you need information about these links or any of that, it'll be available to you. You don't have to worry about rushing to jot these down. We realize that we only have 7 minutes left, so we're just going to open it up for questions that you might have, comments about your participation. Please chat in whatever questions you have about participating in the learning community.
So I've asked for some questions. A lot of people have responded that it all sounds great. It's a lot of information to take in. So we do invite you to share this webinar. There will be a recording, and you are welcome to share it with other members of your team if they're not present, to really think about this and take in the information. I think that's an important component of this. Does anybody have any particular questions for us? Oh, how much time is required outside of the webinars? That's a great question. I think it really depends on your team and the goal that you want to achieve. But in general, what I have seen has worked best is when people set up weekly meetings or biweekly meetings to really focus on what they want to achieve in the organization.
And again, I just want to reinforce that if you're able to do just the minimal, obviously that will have an effect. The greater effect will be that work that's going on in between. But also, I just want to put in context that this is a brief, short 4-month learning collaborative. So we also hope that you might just end up with a core implementation team who's ready to move on certain things. So that may end up being the goal if that's all you're able to do. But of course, as I said, there's more that you can do depending on how much work you do in between activities. Other questions?
How does it sound to everyone? Do you feel like this is something you want to participate in? Are you worried about any barriers? So, you know, are there things that we've talked about that seem undoable for you? I hear a yes. A yes. I'd like to know more about what you're yesing. This seems like something you want to participate in. I hope that's what you're saying yes to. We'd like to know, though, if you want to participate but you're concerned about some of the things that we've talked about, we'd like to know that and talk with you about it or figure out, you know, ways that we can make this doable for you. Again, we are here to support you as the resource team. We're going to take you through every step of the way. We did want to do this really quick poll question. How ready are you to participate in the LC? Would you say ready to go? You're not sure? You'd like some more information? You don't see, you don't think you're going to be able to participate at this time? Or you don't see the need for this learning community? We'd love to know your response to this. If you could just chat in really quickly, A, B, C, or D. How ready do you feel to participate in our learning community? Do you feel like you're ready to go? You're not sure? You don't think you're going to be able to participate at this time, or you don't really see the need?
Yeah. I see one chatted in question too from Amar Hussein. Amar, yep. You're very welcome to join. She's excited to participate and begin creating. So let's see the results of our poll. Brianna, as I'm waiting for the poll results, can I move ahead to our contact information?
Sure, no problem.
Okay. So we'll see the results of the poll in a second. But while we're doing that, oh, here we go. So a lot of no answers, many ready to go. We have about 8 agencies who say they're ready to go, not sure, would like more information, and a very small number who don't see us being able to participate. Well, the good thing is we don't see anybody saying there's no need for RISE, and then many no answers. So this is the thing. I want to put this information up so that you have people to contact. Certainly our email addresses are up here. Please feel free to email us if you want to set up time if you have a specific question, but also to set up time to talk. We're more than willing to talk about this. Please feel free to contact me or anyone on this list via email, and then we'll set up time to talk if you'd like a little bit more time to discuss and get more information that way. So these are all the members of the team, and as I said, please feel free to contact us. Again, you'll have this information within the next 24 to 48 hours, so to use. And then Brianna, what else do we? Okay, so your next steps, if you're going to participate, fill out the application. We'll ask for information about your core implementation team on the application. You'll also have a little summary of what we've presented here today. about the learning community. Also, information about it if you need to send it up the chain and give it to your supervisors or administrators. There's a 2-page description of the learning community with the application that you can use if you want to inform others about it. And then, of course, I think Jason mentioned it earlier, or Kara, but this webinar will be recorded, so you could also access this on the RISE web page at the CTAC website to get more information and share. We also wanted to share with you a few resources here. Kara mentioned earlier, Nadine Burke-Harris, she has a wonderful YouTube video that talks about ACEs. You can look at that or share that with anyone who needs more information about it. The CDC and ACEs, the Centers for Disease Control, has an ACEs webpage on there. And then our own CTAC. If you go to CTAC and you go to that URL, ctac.org, services, best practices, and you click trauma, you're going to see a lot of the offerings and webinars and information that we have related to trauma and trauma-informed care, if you want to get some sense of that work as well. And then these are some of our upcoming events. Very quickly, we have actually, again, our trauma-informed care work. Next week, we have part 5 of our trauma-sensitive school series that's going to be focusing on restorative justice and restorative discipline practices. We have another informational webinar in 2 weeks on February 15th at 12 p.m. for anyone who missed this one. And then we have best practices in treating infant early childhood mental health concerns on February 16th. And then just a reminder that application for the RISE Learning Community is due March 1st. Kara, Jason, Diana, anything else that we need to?
Yeah, just really quickly, I saw some people chatting in about this is going to take some effort and you'd have to get a team together, and we really appreciate that, and we agree it is important to get a team to participate. The core implementation team is really key to this work, so that it's not just you doing all the work, so that you're with a team and you're able to really make an impact on practices and policies around resilience-informed practices. But what I would like to offer is we do have another, as Jim mentioned, another informational webinar on the 15th. So if you have team members that you think you would like to get involved with, you could encourage them to attend there so we could respond to their questions or share the recording or reach out to us if there's any other way we could be of assistance.
Right. And we don't want to overwhelm you, so if you're able to at least get that minimum of 3 people going who are interested in this work and want to move it forward, start there. And then we'll give you whatever support and guidance we can. And thank you again for joining us, and we look forward to working with anyone who has interest in participating in the learning community. Thank you.